For many Americans, trying to get an appointment for a COVID vaccine is still a struggle and might be a struggle for you, even as states begin to widen access. But for some, simply getting to a vaccination site is next to impossible, either because of distance or disability. So an innovative program in Maryland is taking COVID vaccines on the road, getting doses to those in need. ABC's Terry Moran has the story.
Long lines, even longer waits for a COVID vaccine that could mean the difference between life and death. But for Barbara Feldman, a mother of 3 who lives in rural Carroll County, Maryland, waiting in line for a vaccine isn't an option.
Most families that have typical children, they're going to go back to a normal, and we're not. Our life has been upside down for 21 years.
Her 2 sons, 19-year-old Andrew and 20-year-old Jack, both have rare genetic disorders that also make them vulnerable to lung and respiratory issues. And because of their developmental disabilities, they don't understand the importance of masks in public places.
Because they're vulnerable, they would be very much at risk if they got COVID.
Exactly. That and Jack will not wear a mask, so of course I'm going to protect him. And if he won't wear a mask, I'm not going to put him in a situation where it's just not worth it.
So for them, a mobile vaccine unit that comes to their home is literally a lifeline.
It was finally a nurse from the health department that was just doing one of her quality checkups with us that asked if we would want them to come to the house. And I was like, absolutely, we would love for them to come to the house.
And today, their prayers answered.
When Miss Marie comes and she does your, what's that called, your blood pressure, they're going to hold on to your arm.
A medical team from Maryland-based LifeBridge Health bringing the vaccine from its hospitals to their doorstep.
All done! We did it! Yay!
That was so good.
The long-awaited vaccine, along with her network of support, gives Barbara strength.
I bet you a lot of people who will watch this will say, how does she do it?
Well, you don't have any choice. That's the thing, is you step up to the plate. There is no other choice. I mean, what else are you gonna do? These are your kids.
The Feldmans, one of only a few families that day to be vaccinated. This area is rural, with miles of road stretching between patients' homes.
People might say, look, you're getting one here, one there, a few people a day. Is it worth it?
So it's labor intensive, there's no question. Yes, it's worth it. There's no question about that either. These patients who are homebound and at risk deserve access to the vaccine just as much as any other patient. So we're going to proceed until apprehended.
Here in Carroll County, the vaccine supply is severely limited. Only 1,200 vaccines are available on average per week.
What's it been like for you the past year or so?
You know, I was in the military, I've been in Iraq and Afghanistan, and it just kind of, you know, seeing the number of people that we had dying there just takes me back to how horrible, you know, a war zone can be.
In this pandemic war zone, the life-saving armor comes in the form of a needle, and the soldiers dressed in scrubs. We're heading out with the team now. This is about a 15-minute drive from town where we were. It's a very rural county, and this is typical of the work they're doing.
Hello. Hi.
63-year-old John Briscoe was an engineer and worked at an applied physics lab for more than 25 years.
Towards the end of my working years at Johns Hopkins, I drank a lot, and I destroyed part of my brain.
As his dementia progressed, his memory became worse.
It's really shocking when you wake up and you look at your own wife and you don't remember her name.
John's wife, Bonnie, tried for weeks, months, to get her homebound husband and her 81-year-old uncle, Philip, the vaccine.
What aggravates me is I couldn't protect either one of them, and they're so special to me. I don't want to lose them to anything, especially COVID.
For John, he's hoping the vaccine will give him a new lease on life after spending the last year inside.
See, all that waiting, and it just takes a couple seconds.
That's the way it works. I'm realizing I'm only 63.
Yes.
Yes?
Yes.
And my life's not over, and I want to have a life.
And from country roads to city streets, The mobile vaccine unit bringing the vaccine to underserved communities like Harlem Gardens, an elderly apartment complex in the heart of West Baltimore, where Joanne Rankin lives. Joanne is wheelchair-bound, and she suffers from diabetes, high blood pressure, and cellulitis in her legs. She has no car, and her family lives far away and can't take her to get a vaccine.
The bus is okay to use if you have ability to stand up and wait for it.
Joanne was sick with COVID-19 last November.
I don't want to get it again. I don't think the next time I would live for it.
For 4 agonizing days, she laid in an intensive care unit bed, unable to call her mother, who she's called every day at 6 p.m. for years. Her sister also caught COVID, and she died at the same hospital from a stroke while sick.
I called my girlfriend. I said, Debbie, I think you need to know that I'm going to die, so you might want to call my family, because I couldn't do it. And she said, no, you're not going to die. Just keep thinking God's going to take care of you.
Joanne was one of the lucky ones. She survived, but the virus left scars, ones you can see and the ones you can't.
I never had anxiety like I do now. I mean, it's like each day I wake up, I don't want to sleep because I'm afraid I might not get up.
She hopes a vaccine will give her future protection from ever getting COVID again. But when the vaccine rollout began in January, she couldn't find a way to get the shot.
Every time when I talk to them, there's a 3-hour wait, 4-hour wait. I can't do that in a chair.
There are thousands of Americans just like Joanne, people who desperately want the vaccine, but with no way to get one or get to one.
It can still be tough if you are, dependent on a walker, or if you're dependent on wheelchair or some level of support. And then imagine if that mass vaccination site is located downtown. You've got to navigate parking. You've got to navigate, the streets and crossing streets. So we had to be very thoughtful in our approach to equitably vaccinating.
Now this mobile vaccine campaign is giving hope to a community and to the healthcare workers serving there.
There you go. Congratulations.
Many of us as nurses also work in the hospital, and so we've seen the other side of the COVID-19 virus. We've seen the very, very sick. So to be a part of this side of it, where we are preventing, hopefully, COVID, where we're, just making such a huge impact in the community.
There it is. All right. You're ready to roll. Okay.
They are happy, excited to be here, and it's just such a good collaboration between nurse and patient.
So I'm going to give you the shot today, and then we'll monitor you for 15 minutes afterwards.
It just makes my heart burst with joy just being a part of it and doing exactly why I became a nurse.
For ABC News, I'm Terry Moran in Baltimore.
Such inspiring and needed work. Our thanks to all of our healthcare workers, and our thanks to Terry.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.